In this video, I will tell you about the ketogenic diet and its effects on our overall health. The ketogenic diet might sound like a fad, but it's actually been around for almost 100 years. It was originally developed as a response to the pharmacological management of type 1 diabetes and has since been used as a treatment for other conditions that are responsive to dietary manipulation. You probably have your own opinions about the Atkins and ketogenic diets. Some people swear by one or the other, others follow both. Both diets can be effective for weight loss, but they also have some important differences. If you're trying to decide between one of these two diets as a way to lose weight, it helps to know what sets them apart. Here are some of the key differences between Atkins and ketogenic diets. There are many similarities between Atkins and ketogenic diets, but there are also some important differences. Following either the Atkins diet or the ketogenic diet will help you lose weight, but the two diets approach weight loss differently. Atkins diet is a low-carb diet. It focuses on consuming fewer carbs. Keto diet is a low-carb, high-fat diet. It focuses on consuming fewer carbs and increasing fat intake. The Atkins diet has more flexibility. It doesn't require you to strictly monitor your carb intake. It allows you to eat lower carb foods like vegetables, whole grains, and yogurt. But the Atkins diet is criticized for not focusing on eating healthy foods. Instead, it's more focused on lowering carb intake. The Atkins diet is one of the most famous low-carb diets. It's also one of the most controversial. The Atkins diet is essentially a low-carb, high-protein diet. On this diet, dieters eat foods that are high in fat, moderate in protein, and low in carbs. The diet is designed to kick the body into a state of ketosis. This is where the body burns fat for energy instead of carbs. The theory is that by limiting carbs, the body will be forced to burn fat. The Atkins diet has been around since the 1970s. It's been particularly popular in recent years as more people have turned to low-carb diets to help them lose weight. The ketogenic diet, on the other hand, is more focused on healthy eating. It emphasizes eating foods that promote overall health, including vegetables, fruits, and healthy sources of protein. Keto dieters are also encouraged to take care of their overall health by getting enough sleep and staying hydrated. The ketogenic diet is formulated so that your body begins producing ketones, which are produced from the fat stored in your body when carbohydrates are not readily available. These ketones are then utilized as an alternative energy source instead of glucose. This article will explain what the ketogenic diet is, who can benefit from it, potential side effects, and how to get started with this high-fat, low-carbohydrate eating plan. A ketogenic diet is a very low-carb diet that forces the body to use fat as the primary source of energy. This is achieved by reducing the amount of carbohydrates eaten and increasing the amount of protein consumed at the same time. When you restrict the amount of carbohydrates available to the body, it will begin to produce ketones, which are produced from the fat stored in your body when carbohydrates are not readily available. These ketones are then utilized as an alternative energy source instead of glucose. It is a high-fat, low-carbohydrate diet that has been used to treat epilepsy for decades. Recently, the ketogenic diet has also been shown to help reduce body fat, improve metabolic health, and have benefits for people with type 2 diabetes. The first step when starting the ketogenic diet is to reduce the amount of carbs you eat to very low levels. This is because carbs are the primary source of glucose in the body. When the amount of glucose in your bloodstream is reduced, the body has to adjust by turning to fat as an alternative source of energy, which means that you begin to produce ketones as a result. Ketones are organic compounds produced in the liver as a way to generate energy when glucose is in short supply. They also serve as a signal that the body is in a state of ketosis, which means that it is using fat as fuel instead of glucose. The goal of the ketogenic diet is to get your body into this state of ketosis, where it relies on burning fat instead of carbohydrates as its primary source of energy. The ketogenic diet is ideal for people who are looking to lose weight or manage gut health issues like irritable bowel syndrome, IBS. The ketogenic diet can be beneficial for people who are overweight as it allows for a reduction in overall caloric intake. It can also lead to increased satiety and less overeating as a result of the high-fat nature of the diet. Metabolically, the ketogenic diet can help reduce insulin levels, which can be beneficial for people with type 2 diabetes or even pre-diabetes. In fact, the ketogenic diet is sometimes used as a treatment for epilepsy. which is a neurological disorder that is strongly linked to a higher risk of diabetes. How long can I eat on the ketogenic diet? The ketogenic diet is a great way to lose weight and improve your health. However, it is also a great way to lose weight and improve your health in general. If you have type 2 diabetes, it will be beneficial to change your eating habits drastically. The ketogenic diet can be helpful for people who have some type of chronic disease or heart disease. It's also a good option if you have had type 2 diabetes for several years, although this may not be the case in every case. However, if you are on the ketogenic diet for less than 2 months, it can make sense to discontinue the diet completely, as there is no known cure for diabetes or chronic diseases like heart disease. The ketogenic diet does have side effects, such as bad breath and constipation, but these are usually resolved after the body has fully adjusted to the new diet. The ketogenic diet does have some side effects, such as bad breath, fatigue, constipation, and electrolyte imbalance, but these are usually resolved after the body has fully adjusted to the new diet. In addition to these side effects, the ketogenic diet also has a higher risk of nutrient deficiencies and lower bone density, which is why it's very important to take a multivitamin and increase your calcium intake while on this diet. The best way to start the ketogenic diet is to plan ahead so that you give your body enough time to adjust to the new diet. You should also speak with your healthcare provider to make sure that you are on track with your health goals. The first step to starting a ketogenic diet is to reduce the amount of carbohydrates in your diet. The amount of carbohydrates you eat on a daily basis will determine whether or not your body is in ketosis. It is recommended that those following a ketogenic diet consume about 5% of their daily calories from carbohydrates. The second step is to increase your intake of fat and protein. These nutrients will help you stay full and satisfied throughout the day, while also helping you transition into a ketogenic state. The diet is also considered a high-fat, low-carbohydrate (HFLC) diet. This means that the body converts all of its stored fat into energy and burns this energy in the form of carbohydrates. This will help you stay full for longer periods of time and keep you satisfied throughout the day. There are a few things to keep in mind when starting a ketogenic diet. You will need to follow the ketogenic diet for at least 6 weeks until your body is fully adapted to it. Your doctor will also recommend that you drink at least 8 glasses of water per day, which is essential for maintaining a healthy weight. You should also make sure that you are eating enough protein and fat while on this diet so that your body can use all of these nutrients efficiently. The ketogenic diet is an effective way to lose weight and improve metabolic health. It is also a great way to transition into a more plant-based lifestyle. It may be used as a treatment for certain health conditions. The ketogenic diet is a very low-carb diet that forces the body to use fat as the primary source of energy. This is achieved by reducing the amount of carbohydrates eaten and increasing the amount of protein consumed at the same time. If you are looking to lose weight, improve your metabolic health, or manage gut health issues like IBS, then the ketogenic diet may be a good option for you. If you're looking to lose weight and improve your health, you're going to want to make sure that you are eating healthier. You can do that by choosing a low-carb diet and consuming enough fat to keep your body full of energy. If you're looking for a more natural way to lose weight, try the ketogenic diet. I hope this video gave you a better understanding of ketogenic diet and its effects on our overall health. What are your keto experiences? Please feel free to comment.